We've been involved in sports medicine for many, many years. Personally, I started out during my orthopedic residency program taking care of the football team at the University of Florida, as well as some high school football teams around that area. Subsequently, I was working at the Olympic Training Center in Colorado Springs, and I've been a national team physician with the U.S. national team and traveled internationally for about 20 years. Currently, I work with Boston Red Sox and also with Bishop Verot High School. So I've had experience in sports medicine all the way from the high school to the intercollegiate to the professional to the Olympic and elite athletic level. In sports medicine, I think our most important idea is to protect the athlete. In other words, we don't want to take a chance that the athlete is going to get injured further because we haven't treated the injury properly. We want to be sure when we send them back to sport that it is relatively safe for them to return to sport. And a lot of times our decision process involves taking into account the risk of return to sport, when to return to sport, how much sport to return to, and so on. That's obviously very individualized for each person, each injury, and each sport. We do have some ways that we can measure things like that, but all in all, it comes down to a judgment call of the physician, and we like to take the family and the coach and the player into consideration and kind of make a team decision when we make that decision of when it's appropriate to return to sport. So protecting the athlete is the number one goal. The number two goal is to get the athlete back to sport as quickly as we can in a manner in which they are going to be able to perform. If we send them back to play the sport too soon, he or she will not be able to play effectively. If you've got a player, for example, with a dislocated shoulder, send them back to play before the shoulder strength is back, they're not going to be able to tackle effectively. They're not going to be able to throw effectively. They just aren't going to be able to play. So our goal is to try to return them back to as close to 100% as we possibly can. Now, how do we do that? We do that often with physical therapy. We have an athletic trainer that works with us and have had for years. We do it sometimes with casts, splints, and braces, and sometimes we do it with surgery. We certainly invite the parents to come in with the athletes anytime they're injured, anytime they're at the doctor's office, and of course they usually do because they want to ask questions and they want to know. So important to make sure that reasonable expectations are gained and that we all speak together about the safety of the athlete. Sports medicine just doesn't necessarily refer to the professional athlete or the elite athlete or even the high school athlete, but it also refers to the weekend athlete, kind of like you and me, people who enjoy going out on the weekends and playing some sports, and sometimes we get a knee injury or a rotator cuff problem or another kind of an injury from our sports participation. So, you know, in this field of sports medicine, we don't just deal with the organized sports, but we also deal with middle-aged people and older people who want to play sports to keep themselves healthy and active.